And there's something that is not good, but maybe we're on a way to find a solution. The World Health Organization announced a special summit this week consisting of 100 experts to discuss a way to find a cure for Ebola. I24news correspondent Shapira looks at the latest developments and spoke with Dr. Leslie Lobel, an international researcher of immunology who spent 12 years of his life finding a solution to the disease.
The Ebola crisis continues to spread fear throughout the world. A new case was recently found in the Democratic Republic of the Congo, and experts worry it is a new strain of the disease unrelated to the Western African one.
6 months into the worst Ebola epidemic in history, the world is losing the battle to contain it. Leaders are failing to come to grip with this transnational threat.
The politics of science is spotlighted these days in all its cruelty. The Ebola outbreak in West Africa, the worst case since the virus was discovered in 1976, is receiving media attention. Many countries sent aid and medical crews to the infected countries. But when it comes to research, the situation is quite different.
Most drug companies are not very much interested in infectious disease targets or research because they're more interested in drugs that treat chronic diseases like Alzheimer's disease or arthritis, where people need to take drugs constantly. This is the point where governments and academia needs to step in and say, look, this is what the world needs and we need to make this.
For the last 12 years, Dr. Leslie Lobel and his small crew from Ben-Gurion University, Be'er Sheva, are working hard to develop a vaccine for the lethal virus. He claims his center is one of the only ones outside the United States which researches Ebola. Lobel and his partner Dr. Victoria Yavelsky work with the US military to devise a way to conferring long-term immunity against the disease. As opposed to other groups who concentrate on animal research, Lobel's focus on the survivors.
We follow every survivor from every outbreak in a certain defined area of Uganda and now in the DRC. We've actually meet them personally. We show interest in them. We follow them medically to make sure they're healthy or if they have other health problems. Whatever we produce from the blood of Africans goes back to those countries for free.
So far, several vaccines have been tested in the United States, but almost 40 years after it was first discovered, no licensed vaccine for Ebola is available, and most efforts to combat it deal with prevention and control. But as the death toll continues to rise, no solution is in sight.
There are very few sources of funding available to virologists. There is not enough research. That's why we don't have a solution to the problem yet. There are not enough good people doing this.